Relegated to the background, the treatment of the sick is often neglected for the benefit of petty interests, inflicting unjustified punishment on the latter. They suffer from surgical pathologies which swarm like viral epidemics under the blinded eyes of a population monopolized body and soul by those who were among the most informed. Inguinal hernia is the protrusion of an abdominal viscus through an area of weakness in the inguinal region. The protrusion can occur directly through a fault at the rear of the inguinal canal, in this case it is a direct hernia, or on the contrary, in an indirect hernia, the viscera protrudes through the internal inguinal ring and exits through the external inguinal ring of the inguinal canal before descending into the scrotum. Inguinal hernia is part of the long list of illnesses from which a large part of the Haitian population suffers, and we would like to present its treatment through a retrospective study that we conducted at Fatma Hospital, sharing our experiences in order to contribute to better management of this surgical pathology. Anatomical reminder. Anatomy of the inguinal canal. The inguinal canal is a cone-shaped conduit approximately 4 to 6 centimeters long located in the anterior part of the pelvic pelvis. The canal begins on the posterior abdominal wall, where the spermatic cord passes through the deep, internal, inguinal ring, a hiatus in the fascia transversalis. The canal terminates medially at the superficial, external, inguinal ring, the point at which the spermatic cord passes through a defect in the external oblique aponeurosis. The boundaries of the inguinal canal include, the external oblique aponeurosis anteriorly, the internal oblique muscle laterally, the conjoined tendon posteriorly, the internal oblique muscle superiorly, and the inguinal ligament inferiorly. The spermatic cord passes through the inguinal canal and it contains 3 arteries, 3 veins, 2 nerves, the pampiniform venous plexus, and the vas deferens. It is enveloped in 3 layers of spermatic fascia. Additional important structures surrounding the inguinal canal include the lacunar ligament, Cooper's ligament, inferior epigastric vessels, Hasselbeck's triangle. Materials and methods. As part of our study on the management of inguinal hernia, we conducted a retrospective study based on information collected in the notebooks of the operating room of the Fatma Hospital in Les Cayes, in the files of certain patients. In case of necessity and our own experiences in the exercise of our function as surgeon. This survey includes all hernia surgeries performed by the hospital's surgery department between the months of July and December 2021. The variables studied are age, sex, laterality, preoperative preparation, operating technique, anesthesia, postoperative follow-up, postoperative evolution, and mortality. This data is processed and analyzed on AP Info. Goals. Our objectives consist of: first, give an overall idea of inguinal hernia and its treatment at Fatma Hospital. Second, to give an idea of our commitments in the fight against this debilitating disease. Third, participate in the training that the institution makes available to interested parties. Results. The prevalence. During the aforementioned period, 124 cases were operated on, and among them 7 patients had undergone herniorrhaphy, which represents 5.65% of all surgical interventions carried out by the hospital. Sex. 86% of patients operated on for inguinal hernia were male, compared to 14% female, i.e. a sex ratio of 6 men to 1 woman. In adults, 100% of operated patients were male. The prevalence of inguinal hernia was 1.43% in women and 13.33% in men. Age. Regarding age, patients who underwent herniorrhaphy were divided into 3 groups: infants who represented 14.2%, children, 57.14%, and adults who represented 28.57% of those operated on.
Therefore, 71.3% of patients were aged less than 11 years. Laterality. The hernia was on the left side in 57.1% of cases, on the right side in 28.5% of cases, and in 14.2% of cases its position was not noted. The different types of hernia that we had operated on. In 76.4% of cases it was inguinal hernias, and in 28.5% of cases, it was inguinoscrotal hernias, half of which were strangulated. In 100% of infants, inguinoscrotal hernia was associated with an umbilical hernia, as was the case in 25% of patients in the children's group. The staff for carrying out the interventions. The intervention was performed by 2 surgeons in 71.4% of cases, by 3 surgeons in 14.2% of cases, and by the association of a surgeon and a nurse in 14.2% of cases. Anesthesia. 71.4% of interventions were performed under general anesthesia, 28.5% under spinal anesthesia, and 100% of the anesthesiologists were nurses. Preoperative preparation. Among the different cases in our sample, 2 of them were emergencies, the others were selective cases. The duration of preoperative preparation varied. For selective cases, it began as soon as the disease was diagnosed and reached the day of the operation, fixed in advance by the surgeon. For emergencies, the expected time for the intervention to be carried out was 6 to 12 hours. The duration of postoperative follow-up in hospital. In general, patients are kept for 6 to 12 hours in the department after the surgical procedure, in order to rule out a possible complication, after which they are discharged with a prescription to fill. Postoperative follow-up was simple in 85.7% of cases, since in 14.2% of cases patients returned to release the sutures at the wall level. The operating technique. The Bassini technique is the technique that we used in 85.7% of our patients, although various techniques such as Scholdes, McVeigh, Lichtenstein are available, they each have their indications. The original repair includes dissection of the spermatic cord, dissection of the hernia sac, then its high ligation and extensive reconstruction of the floor of the inguinal canal. After exposing the inguinal floor, the fascia transversalis is incised from the pubic tubercle to the internal inguinal ring. The preperitoneal fat is sharply dissected from the upper margin of the posterior aspect of the fascia transversalis to allow adequate tissue mobilization. A repair is then carried out. The internal oblique, transversus abdominis and fascia transversalis are attached to the edge of the inguinal ligament and the pubic periosteum with interrupted sutures. The lateral aspect of the repair reinforces the medial edge of the internal inguinal ring. Mortality. Mortality as well as recurrences were 0 for this procedure at the Fatma Hospital. Discussion. The prevalence. According to a study entitled Worldwide Magnitude of Inguinal Hernia involving 51,304,093 cases, published by Open Medicine, in October 2022, the prevalence of inguinal hernia is 7.7%, which roughly corresponds to our findings, which is 5.6%. Sex. This same study published by Open Medicine found a prevalence of 9.6% in men and 1.3% in women, which roughly corresponds to those of our findings where the prevalence of hernia repair was 1.4% in women and 13.3% in men. Age. We found a peak in incidence during childhood, 71.3% of patients were aged less than 11 years, and another peak at 45 years, which corresponds to the findings of the Schwartz Principles of Surgery, which relates a peak in incidence before the first year of life and another after the age of 40. Laterality. In his medical thesis, Dr. Amal Aramak found 68.7% of hernias on the right, 26.7% of hernias on the left and 4.5% bilateral, which is completely different from our study where the hernia was on the left side in 57.1% of cases. On the right side in 28.5% of cases, and in 14.2% of cases its position was not noted. This disparity could be explained by the fact that the hernia being linked to physical activities will be positioned according to the respective activities of the populations. The type of hernia. According to a study conducted by the scientific search publisher entitled Inguinal Hernia in Adults conducted in Bamako, Mali, 75% of hernias were indirect, while in our series, 76.4% of hernias were direct inguinal hernias, compared to 28.5% of hernias. Inguinoscrotal. This disparity could be explained by the fact that his study only concerned adults. Anesthesia. In his medical thesis, entitled Inguinal Hernia, Dr. Amal Aramak reported the use of general anesthesia in 37.5% of cases, and spinal anesthesia for 62.5% of patients, while in our study, the general anesthesia was the most used. We can easily understand this difference explained by the age of our patients, which was less than 11 years old in 71.4% of cases. Operating technique. According to the same aforementioned study published by the scientific search publisher entitled, Inguinal Hernia in Adults, the Schultes technique was used in 68% of cases, while on our side, the Basini technique was used the most, representing 85% of cases. Post-operative follow-up. According to this same study, entitled Inguinal Hernia in Adults, post-operative follow-up was simple in 85.4% of cases, which corresponds exactly to our findings, or a complication, a type of dehiscence of the operating wound, occurred in 14.2% cases. Conclusion. Defined as the protrusion of a viscera through an area of weakness in the inguinal region, inguinal hernia is treated at the Hospital au Fatma de Case, where its prevalence, 5.6%, testifies to the extent of this disease, which burdens the population, particularly men, with a sex ratio of 6 men to 1 woman. Its peak incidence is twofold: the first occurs in childhood at 9 years old and the second at 40 years old. In our series, it is on the left in 57.1% of cases. For surgeries, general anesthesia was used the most, particularly because of the young age of our patients. 71.3% were under 11 years old. Direct hernia was most often encountered, representing 76.4% of cases. The Basini technique was used in 85.7% of cases. Mortality as well as recurrences were 0. The team is dynamic and thirsty for support and deserves compliments, although much remains to be done to improve the situation of our suffering compatriots. We hope that this study will provide some useful information and contribute to better management of inguinal hernia.